a lot of public health professionals, CDC is like that's the top of the line for all of us. We're seeking to kind of get to that point in our career, and for me to have reached that point pretty early on was amazing, and I was happy to be there, and I, felt like things were finally going right for me. But I also didn't feel like um, I had enough experience, or like I don't know. I wanted to build my resume. I wanted to earn another degree, but it just wasn't going to work had I stayed in that program. And so that's what I decided to do. Just decided to kind of like go against the grain and work on achievement of my master's in public health. And it's never the end of the road, even though if you've gotten so far and you decide to take a step back to do something that's it's best for you in the long run. I would say, definitely do it because it's not the end of the road. You can always get back and even come back stronger than you were.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Welcome to episode 123. Hi everyone, I'm Myles Richards here. Thank you so much for joining me. If this is your first time here, be sure to subscribe. I appreciate you joining. Hope you're ready for some great public health stories and some great career insight. Today, we have someone with experience in supporting policy regulation and compliance. He got his Bachelors of Science in Kinesiology at the University of Maryland. He was selected in the CDC Public Health Associate Program and has supported other agencies such as DHHS and the FDA before earning his Master's of Public Health at the University of Maryland. He currently works as an epidemiologist at the DC Office for the Chief Medical Examiner. We have Myles Davenport, MPH. Davenport, apologies. I always ask, but I forgot this time. Welcome to the show.
Thank you. Appreciate it.
Yeah,
happy to be here.
My pleasure. So tell me how you've been doing and how you've been coping during these like 2 crazy years.
It's been a roller coaster. At the start, of course, it's been a challenge. Things have gotten a lot better, but I'm still just trying to find a routine. But I'm doing all right. How are you doing?
I'm doing well. As I was telling you before, Hurricane Ian is coming this way, but it should be a tropical depression by the time it hits. By the time people listen to this, I guess they will know what's going on Instagram or something like that. But hoping for the best. I'm doing well though. Very, very like positive outside of that. So tell us, how do you identify, and tell us a little bit about your personal background?
All right. Identify. My pronouns are he, him. Personal background. I'm born and raised in the DMV area, Prince George's County. Was homeschooled throughout high school, but had a lot of different little creative interests. Photography was one of them. I was an athlete in high school, and that kind of led me down the route of healthcare. So I had a close friend that I admired growing up who actually pursued physical therapy. And after seeing her go through that route, I kind of decided that maybe I wanted to take that route. But since then, it's changed a little bit, but still, still in public health.
Okay, we love that. So you were homeschooled in high school, but you played sports in high school. How does that work?
Yeah, so I played sports for a small private school in the area. That's kind of how I was able to earn my physical activity credits. But it was fun. I played all 4 years in high school. We did really well, and we won a few championships. So it was great.
Yeah, that's awesome. And yeah, I'm happy that like that path led you into public health. And to that point, what does public health mean to you?
To me, I feel like it's a really broad question. I mean, the field itself is very broad, but public health really just to me means finding a problem and serving your entire trying to support your entire community by supporting your community and addressing their healthcare needs. And that could be a variety of different things. As we know, like health encompasses a lot of different areas in our lives, whether it be our physical health or mental health, our built environment. So that's what public health means to me.
Yeah, and I agree with you completely. It is very broad, and you get very broad definitions from different people, but all encompassing like supporting community and helping people around health and well-being. So you got your associate's degree in general studies pre-physical therapy at Prince George's Community College. So tell me about how that works out.
So um, initially, when I was graduating from high school, um, didn't quite know what I wanted to do with my life. My father was an engineer, and he had always been kind of pushing me to go into STEM fields, but I didn't really feel like that was my calling in life. But thankfully, my mother, she kind of allowed me to pursue my own interests. And like I mentioned earlier, a close friend of mine had pursued physical therapy. And since I felt like she and I had very similar interests, I decided to do some more research into that. And that's kind of where I initially thought my career was going to go into. So kind of the deadlines of college applying. I had already applied to schools not knowing exactly what I wanted to study. And by the time I did have a solid idea what I wanted to do, is a lot of the schools had already sent back the acceptance letters, and they weren't, the degrees that I was interested in. And then doing some more research, they didn't have a degree that kind of followed my interests. So I decided to stay home, and actually it was a great idea in the long run. Stay home, go to a community college, and knock out some of my prerequisites for a physical therapy degree while getting my associates.
Do you care about public health and health equity? Have you been looking for value-based apparel? Well, the Public Health Store has got you covered. Rock simple value-based design apparel that will surely have others interested in engaging in meaningful conversations with you. The Public Health Store has apparel for you to rock in class, around the office, or just casually around town. Wear your values where people can see them. Visit the Public Health Store at thephmillennial.com/shop. That's thephmillennial.com/shop. And use the code podcast for 10% off your next order. Okay, now back to the show. Yeah. Definitely is something that like I advocate for because in the narrative of it is that you're so young, like a lot of people don't know. And like to your point, you're like, okay, I see that my friend is doing this. We share the same values, think about the same things. So let me try out and see if this is something I like. And I wanted to ask before we get more into it is like, you said in the long run, looking back on this was something that really helped you. So would you talk to that point?
We hear it a lot, like college is not cheap, and going to school 4 years, especially not knowing what you want to do with your life at the start, you could be wasting a lot of time and money. So I'm thankful for um, kind of like going through college at a slower pace and saving money at that. But it also gave me the opportunity to do some other things outside of college. So I had always been working throughout school. And so while I was working on my associate's degree, I was able to gain some practical experience working in a physical therapy clinic. Um, and I saw, a lot about the field. Some things that I appreciated, some things I didn't quite appreciate. And I think that's kind of what helped me make the decision to pursue other interests in the healthcare field.
And to that point, was it more that things pushed you away from it, or there were things that pulled you into something else?
I feel like it's a little bit of both, for both good and bad reasons. I don't want to say one more than the other, because I still appreciate the field itself, but I also know that, obviously that wasn't I wasn't really fit for that path. I feel like there are some aspects of that field that I would like to pull into a different sort of focus and just tweak it a little bit.
Yeah, that makes sense, and I'm glad that you like were able to figure that out young while you're doing community college, like really taking your time, and as you said, the benefits of it. So after this, you got a bachelor's of science in kinesiology with a technology entrepreneurship minor at the University of Maryland. So tell me about the transition from community college into this, and why kinesiology.
Right. So even still, while I was pursuing my bachelor's degree, I was still really much focused in physical therapy. And so that's the reason why, well, not the only reason, but that's one of the biggest reasons why I decided to pursue kinesiology, which is it means the study of human movement. And I really enjoyed that program at University of Maryland. I honestly don't think there's any other major that I would have been interested in completing. So I really had a lot of fun studying that. However, that transition came about because while I was at Prince George's Community College working on my associate's degree, I was able to, I discovered a scholarship program called the Hillman Entrepreneurs Program, which has then it's since been rebranded, but at the time it was called Hillman Entrepreneurs Program. And that scholarship program, if you completed it at the community college, it followed you to the University of Maryland. So I was able to even save some more money there while working on my bachelor's degree.
Okay, that's awesome. And were there any other like perks or benefits of getting that scholarship or being part of that program?
Yeah, I'm sorry. Yep. So that's actually how I earned my minor. So when you complete the program at the community college and you transfer to the University of Maryland, there's courses that you take underneath that program that help you earn that minor degree. So it's really focused on students who are interested in starting their own business one day.
Okay, that's really awesome, and that's something that I've never heard before in my life. So I'm glad that you're sharing that. And was because and it was also, you said, a Hillman Entrepreneurship Scholarship. So was there, but you got a technology entrepreneurship minor. So was it that you
Mhm.
chose to do technology, or was that the only type of entrepreneurship minor that you were able to do?
That was the minor that the program offered. You didn't have a choice, but not that it was a big deal anyway, because they were giving me money to go to school. So I appreciate everything that they offered. So yeah, it just enhanced my entire experience, honestly.
Yeah, that's definitely awesome, because I feel like you don't hear about many people in the health field doing business related or entrepreneurship related either courses or classes, or actually doing it in the field. So that makes sense. And during your time as a bachelor student, you're also a certified pharmacy technician at CVS Pharmacy. So tell me about that experience.
Yeah. So while I was earning my associate's degree, and I think maybe the first year of my bachelor's degree, I was working at a outpatient physical therapy clinic. And then I just, even though I gained a lot of experience and I appreciate those that I met along the way, all the physical therapists that supported me along the way, I felt like it was time for me to kind of explore other areas of healthcare so I can build a more broad perspective of the healthcare system. And so I decided to look into pharmacy, and I earned my pharmacy technician certification through CVS Health, and I learned a lot about the entire pharmaceutical process, insurance, pre-authorizations, medications that are, or the types of illnesses and diseases that are prevalent in my own community. Um, if you've ever worked at a retail pharmacy, you'll notice that the inventory that they have in one pharmacy may be drastically different from the inventory they have at a different pharmacy, because you might have the community might be um, one community might be facing more healthcare issues than another. So, for example, my community live in a majority African American community, and as we know, a lot of African Americans suffer from high blood pressure. So, the pharmacy that I worked at, they had a lot of high blood pressure medication in stock, and that may be different from another pharmacy that you would work at. So, I learned a lot about that, different things that are affecting the area.
And I think it's just important, going back to you coming out of high school, not really knowing what you want to do some PT, do some pharmacy stuff, and as well as knowing that you want to do something in the health related field. So it's like, you want to do health related field, but what aspect of that? And it seems like you're just taking different experiences, getting that exposure and seeing what you like, what you don't like from it. And to that point, your next experience was as a maternal child health careers leadership education advocacy and research network intern, Kennedy Krieger Institute. And that was a long title for that
Yeah,
internship.
it's a big name. So I can talk about that. I was selected into this. It At first I thought it was going to just be a summer internship, but it turned out to be basically a entire year. But the summer was kind of the bulk of the experience. It was hosted at the Kennedy Krieger Institute, but it was sponsored by the CDC, CDC Undergraduate Program for Scholars. So the abbreviation is CUPS. But the host site was Kennedy Krieger and the Johns Hopkins University. And so during that program, it was really focused on maternal and child health. But I even still had the opportunity to kind of get some more direct experience working in physical therapy. They have a cord injury, I can't remember the name right now, but they have a center specifically dedicated towards suffer from spinal cord injuries. So I did some research on that, or was supporting some clinical rotations, but I also did some spinal cord injury research on men who suffer from spinal cord injuries.
Great other experience. And also, the last position I have here during your bachelor's program was a research interview at Impact International. So tell me about that experience.
To be honest, I feel like I was kind of not necessarily going through the motions, but you know, when you're an undergrad, you're searching for opportunities that you feel like may be beneficial to you, or you're trying to grow your resume. But I can't remember how I heard about this opportunity, but in that role, I learned about how corporate research is performed. It was I basically worked in the call center, but and at the time, I'm not really, you're not really thinking about what you're learning and what you're gaining from the experience. So I was just following protocol, reading scripts, answering questions, categorize answers and stuff like that. But looking back again, like I know that I learned how corporate research is performed, and it wasn't a very educational experience, but it got me through through college a little bit.
Yeah, fair enough. And I know Impact Health International is an organization that I see many like undergrad students or recent graduates look for. So just more great experience. And did you have like any takeaways from your undergrad experience?
As far as working or school specifically?
Both, if you like.
I guess I would say to pursue a degree that interests you. Like I mentioned, before early in the call, I personally didn't feel like I would have been able to even complete um, any degree if my heart and mind wasn't truly into it. I had a lot of fun studying kinesiology. That's because at the time I was really into physical fitness and physical therapy and all that stuff. So I had a lot of fun learning about the body. So I mean, I would just say make sure you study something that you like, because otherwise you're gonna have a really hard time.
Yeah, that absolutely makes sense. And another question I wanted to ask is, so you did physical therapy stuff, you did pharmacy stuff, you did work with the spinal cord, you did other corporate research. What was the like thing coming out of undergrad that you were thinking you would do, or like you would work for? Or was that goal coming out of undergrad, or was that still unclear for you?
Okay, so my biggest goal, I wanted to um, I wanted to kind of be a director of a healthcare clinic. For the longest time, well, even still, one of my dreams was owning a holistic healthcare center that doesn't necessarily accept insurance, but incorporates some of the modalities that, say, physical therapy offers, offer some services that um, are not considered allied health fields. So, like massage therapy, um, and other practices like that. Because I feel like even though it may not be accepted or covered in Western medicine, I wouldn't completely disregard the effect that it may have on people's lives.
Yeah.
So I wanted to grow going through all these experiences. I was trying to um, kind of like put together in my mind a type of holistic healthcare center that I felt like would encompass that idea.
I love that. Love that. That's pretty dope. And and then another question I want to ask. So your first position after your bachelor's program was at the CDC Public Health Associate Program. But how did you find out about public health? When did that happen in your journey?
It was during that internship with Kennedy Krieger. That's when um, I was exposed to a lot of the different areas that you can go into, and that really kickstarted my career.
Okay, that makes sense, and I'm glad that you were able to get that experience. And as I always say, people could probably tell I'm going to say it like the exposure is just so important. Getting exposure and then experience, and then figuring out what you want to do. So you were a CDC Public Health Associate Program Advisor. I think that's what they call it. I don't know. But tell me how did you get into that program, and then what was that experience like?
So I actually heard about that program through the CUPS program while I was at Kennedy Krieger. Um, the Kennedy Krieger internship, they flew us out to CDC, I think for the first week, and during that orientation, that's when they went through all the different type of public health, um, I guess strategies, national strategies, but then they also shared with us the opportunity for once we complete our bachelor's degree that would be eligible for this public health associate program. And so um, I had it in the back of my mind, but I wasn't quite sure if I was actually going to apply because, again, at the time I was interested in going into physical therapy. So, and you only have 2 years. You have a window of 2 years that you're eligible to apply. So after finishing my bachelor's degree, um, I tried to get into physical therapy school, didn't get in, um, and then I was trying to figure out what I was going to do with my life. So I was actually I had decided to try to retake some classes, um, and that's actually kind of going into another story. I had pretty I feel like I pretty much was going to get into physical therapy school, but I was only a decimal point shy of my prerequisite GPA. I feel like my entire application was fine. It was just my prerequisite GPA that was just a decimal point shy. Not an entire point, just a decimal point. Um, so I was after my bachelor's, I was trying to retake some prerequisites to improve my application. And then after a while, retaking some classes, I thought to myself, you know what? I don't think I really am feeling this. So then I kind of looked at my other options, and then I remember the public health associate program that was mentioned during the other internship, and so I applied to that. Didn't get in the first time. Then I applied the second time, and waited about 6 7 months. Finally found out that I got selected, and I was like, okay, great. Like this is a once in a lifetime opportunity. Let's go for it. Um, and so yeah, that was a great experience. I was assigned to the Maricopa County Department of Public Health, so I relocated all the way from DC, Maryland, Virginia area, about 2,000 miles away from family and friends to Phoenix, Arizona, working in STD, HIV prevention, and I supported the congenital syphilis outbreak out there and learned a lot. And decided to move back home. Um, didn't complete the program um, because I had deferred enrollment from my master's degree. If I hadn't gotten into PHAP, I would have gone to graduate school. So I deferred enrollment, only had about a year for deferring, and decided it was time to come home and work on my master's degree. So that's what I did.
Yeah, that's awesome, and that's definitely a big leap. Kudos to you for like continuing to persevere, even though you didn't get in the first time, but still trying for the second time and being able to go to the other side of the country, and you weren't able to complete it. Was it is PHAP usually 24 months, 2 years?
Right. Yes, it's 2 years. So I was in it for about 11 months.
Okay. Yeah, and I don't give you wrong. I think that's one thing like one of my uncles told me growing up is like even if you take an internship and leave it, like do it, you know, like there's no
Yeah,
to them there's so many other people that would do it, but if you have better opportunities, don't shoot yourself short because you have this thing here, you know. So to that point, that's awesome. So when were you thinking about your master's of public health? Was it that you didn't get into physical therapy school and then and then you're like, okay, this isn't making sense, but public health is something that I know that I'm familiar with, and then applied for master of public health? Or tell me more about that.
I feel like it was actually a little bit of everything. It was what you just mentioned. Um, I was also struggling with finding meaningful employment with a kinesiology degree. Um, those who may be listening to this podcast might be able to relate, or maybe not. But I feel like after I had my kinesiology degree, there weren't that many employers who were seeking someone um, with that degree. It's really focused to a specific um, field, which is physical therapy or personal training or athletic training, something like that. So, um, I had no problem with finding opportunities related to personal training or working in a gym, working in a healthcare center, but I didn't necessarily want to continue down that route. I kind of wanted to expand my experience, expand my knowledge and stuff like that. Um, and I also wanted to build my education and learn more about public health in general. So, at the School of Public Health at University of Maryland, I met a lot of different people who pursued a lot of different career fields, and I felt like earning my master's of public health would be a great way to learn more just about the field in general, and then also give me the opportunity to gain meaningful employment um, after getting the degree. So, um, yeah.
Yeah, I appreciate you sharing that. And just to make a note here for people who might be in their bachelor's programs is to like check to see if your major is something that has a lot of opportunities. It has a lot of opportunities specifically in your geographical location. I think that's something that people don't think about, or just generally, is it a field that's growing or is it a field that's shrinking? And public health is an interesting one because people are leaving the field, but the need for it is growing. So, but that's not for today to discuss. Okay, but that's awesome. Did you have a concentration at the University of Maryland?
Yes. My concentration for my master's program was health policy analysis and evaluation. Um, and the reason why I chose that, they had many other concentrations. They had health, I think one was specifically health policy, then they had epidemiology. They just introduced a new one for public physical activity, I think. Um, and a couple others. Sorry, I can't remember them all right now, but the reason why I chose mine was because I just felt like it was one, I had a strong interest in health policy. Um, two, I didn't necessarily want to um, like um, limit myself because I feel like sometimes, again, employers may see that you have a degree with a specific concentration and think that you're only quote unquote good for that subject area. So I kind of just wanted to make myself more appealing.
Yeah, that makes a lot of sense, and and it is interesting. And I guess I'll ask you this later on because you're an epidemiologist now. But I think that's also important to highlight that you don't have to have a concentration in epidemiology to become an epidemiologist because you can still gain those skill sets and have experiences to build on that. So during your
Right.
MPH program, you were a HIPAA analyst, government contractor. So how do you get that position and what do you do in it?
So it's crazy because I applied for that role while I was still in Arizona, and that's kind of like was my kick to relocate because I was debating whether or not should I leave or should I stay in this program. Um, but once I received once I found out that I had a job coming back to Maryland, I was like, all right, great. Now I can support myself and go to school at the same time. But yeah, I applied for that role. I got in, and I just feel like my resume sort of spoke for itself. It showed that I had experience and knowledge about healthcare, and I really had a great time working with that team. I learned a lot about how the government enforces the um, the HIPAA Act, civil rights laws, conscious religious freedoms, and then I was promoted a few months later to be a triager. So went from um, reviewing, or I'm sorry, went from drafting the letters um, for complaints to being the first eyes on a case and determining what type of violation um, the allegations may be.
It's awesome that you're able to get a promotion 3 months after starting it as well, which is not something you hear very often, especially as like an MPH student. I had a question that came up that I feel like I should kind of just pass over, like about the PHAP program. So you said it's a once in a lifetime dream opportunity that you got into. 11 months
Mhm.
in, you decide, okay, I deferred my MPH, but I want to do this. I have this job in back home in Maryland. Tell me more about that thought process, because and was the 11 months actually you there very valuable to you?
It was a very hard decision. This was my first federal opportunity. Um, Although I wasn't a full-time employee with PHAP, there was still conversation about being what's the word, converted to a full employee. So had I stayed in the program, then I would have been eligible to be considered for other full-time employment opportunities to stay in the CDC. And as you know, a lot of public health professionals, CDC is like that's the top of the line for all of us. We're seeking to kind of get to that point in our career, and for me to have reached that point pretty early on was amazing, and I was happy to be there, and I, felt like things were finally going right for me. But I also didn't feel like um, I had enough experience, or like I don't know. I wanted to build my resume. I wanted to earn another degree, but it just wasn't going to work had I stayed in that program. Um, and so that's what I decided to do. Just decided to kind of like go against the grain and work on achieving my master's in public health. And it's never the end of the road, even though if you've gotten so far and you decide to take a step back to do something that's it's best for you in the long run. I would say, definitely do it, because it's not the end of the road. You can always get back and even um, come back stronger than you were.
I completely agree with that. And yeah, for many people, the CDC and federal government is their dream. I would say that was never my dream in public health, just so people know. And I feel like a lot of other people out there as well. Just so you know, there are so many other amazing roles outside of the CDC and federal government. Granted, like if that's what you want to do, feel free to do it. I don't think I'll see myself in those roles, but that could change in time depending on like what impact and things are. So recruiters, look out for me in the next couple of years, maybe. We'll see. Uh, and then during your Masters of Public Health program, so bringing you back to that to then, you were a student trainee admin support at the FDA. So it's not a big organization, and it's awesome that you gotten experiences with so many like great big organizations to really fill out your scope and understand different things in public health and really I'm guessing apply a lot of the skills and a lot of the things that you have learned during your schooling. So tell me about that position.
Okay. Yeah, sure. So one of the requirements for my degree, which I'm sure is the same for a lot of other graduate programs, was that I had to complete a an internship requirement. So I, luckily living in this area, there's a lot of opportunities, a lot of government agencies that offer internship opportunities. So um, thankfully, I applied for this 1 year pathways program, the path program with the FDA, where I supported the Center for Tobacco Products. And in that role, um, I helped review some of the applications that came in from tobacco product manufacturers. And it was mainly just data entry, but it exposed me to some of the tobacco product pathways that the FDA enforces. And I learned about the Tobacco Smoking Control Act. I think that's what it is.
Yeah, yeah, that's definitely great to be able to just grasp new information, even if it's just entering data. I know I entered a lot of data, printed a lot of reports back in my
Yeah,
internship days. That's just something you got to do sometimes, unfortunately.
yeah. So
And then,
that's a big part of, I think, most of our public health experience. A lot of us go through, like, you have to go through the trenches, and sometimes data entry is part of that. But it it's like growing pains. Like, you, once you do it, you understand its purpose and why it's so important.
yeah, absolutely. And to be an expert is to be able to do the simple things and do them easy and just know about them. And I'm guessing like that data entry is definitely very helpful in, or at least somewhat helpful and useful in some of the work or help in the work that you do now as an epidemiologist, I would imagine, because it's a lot of data, however you want to say it, tomato.
Right.
Um, uh, and Black men in public health.
So we're there. You go. Actually, we're working on it. So everyone, Omar, if you're listening, you don't see it, but he's wearing a Black Man in Public Health T-shirt, and so this is a organization that um, a few other brothers and myself are working on incorporating. The T-shirts are a way for us to raise funds to support the organization and expand the organization and new capacities. So I'm not the founder. I am sort of like the marketing strategist. I am working on the merchandise as well. So yeah, so Derek Anderson is the guy who initiated the organization, and right now that you can find the group on Facebook. Just type in Black Men in Public Health, and it's a network for Black men to collaborate and share information and just be a resource to other Black men going through the process, either trying to figure out your path in public health, or trying to find other people to network with in your career, or even move forward in your career. So yeah, that's what it is right now. It's a Facebook group, but we're working on expanding it to include other resources as well.
And how'd you get involved with it? And I was not aware that you were not the co-founder, so I apologize.
No problem. It's okay. So I kind of had this idea for how long? I don't know how long now, but just going through school all this time, through my associate's degree, through my bachelor's degree, even my master's degree. But it started off like during my associate's degree. In a lot of my courses, I was um, one of few African Americans in the class, and then not even to talk about the men in the class. So it's a double whammy. I'm already not represented well in these cohorts. So then I started to realize, okay, there's not a lot of Black men who are pursuing this career field, and it would be great to have someone that I can kick it with or share ideas with. And I know the struggles that I was going through as a minority, as a Black man, and I just wanted to create a resource, so that we can all connect, and share ideas and stuff. So I think it was like in 2018 when I started to to try to create something of my own. But then that's when I discovered that there was already a Facebook group that was created, and since then it's grown. I think at the time it was about 1,000 members. Maybe I think it's closer to 2,000 now. Maybe about 1,500. I'm not quite sure, but um, yeah, we're still working on building it out. So yeah, it's been around for, I would say, at least 5 years now.
Hey, that's awesome. Well, I'm definitely we'll talk about this on the back end, but I'll definitely happy to help and support with that. But that's awesome that you're able to. I think that's also important for people to know is like a lot of people want to start things because they didn't have that community, and a lot of the times somebody has already started something, so it's like why not support and build and collaborate together as opposed to trying to
Right.
build and do your own thing. Um,
Yep.
which like sometimes it's fine. Not to say, but just say collaboration is also good, and I think it's a fundamental point in public health. And if people were looking to get the Black Men in Public Health teas, where can they find them?
So you can find these at bmiph.org, and they're currently listed at $25 a piece, and we'll ship them to you as soon as the order comes in. So looking forward to actually expanding that website to be more of just a store. Trying to we look forward to probably doing some conferences, some local chapter meetings, a community service, and a lot of different ideas. So feel free to even send out a message to share any ideas that you might have, and hopefully we can incorporate it pretty soon.
Awesome, awesome, and I'll definitely link that in the description and the show notes for anybody that is interested in. Have you been interested in connecting with a community of people who are passionate about community health while working on improving their own personal well-being? Well, lucky for you, the Community Health and Wellness Discord server is where you want to be. It's a free online community I co-created just for people like you. You'll find friendly people talking about important public and personal health topics, asking amazing questions, sharing valuable information, while connecting with each other to build a better culture of well-being personally and at the community level. Join this free online community by going to thephmillennial.com/join. That's thephmillennial.com/join. See you there. Now back to the show. So after you graduated from your MPH program, you became a regulatory health program manager for the FDA. Tell me a little bit how you got into that position and what you do in it. Is this after? No, that's not after your MPH program, is it? That's during your MPH program.
It was during, yep. Towards the end of my MPH program, I think. Yes, right. Yeah, it's time just flies by when you're just
COVID made things
trying to
crazy too.
yeah, COVID's made everything crazy. Um, so after my student trainee internship was over, I was really interested in continuing to work for the FDA. I had a strong interest in tobacco product regulation, especially after learning about the Jules incident. Once, for those who don't know, when e-cigarettes first came out, they weren't necessarily considered tobacco product under the FDA, and so, or not under the FDA, under the Tobacco Smoking Control Act, and so they got away with a lot of marketing towards youth, and that's pretty much the biggest smoking issue that we have in America is smoking among youth. So when electronic cigarettes came out, there's nothing really stopping these companies from marketing towards high school students, and so eventually the FDA caught on, and then legislation passed to include electronic cigarettes, and so that's kind of what sparked my interest. And like I said, after my internship was over, I was really interested in continuing that work. And so thankfully, I think it was like maybe 3 or 4 months later, I was accepted. I received a role. I received an offer as a regulatory health program manager. And in that role, I helped, again, supported the FDA with making sure tobacco manufacturers their applications were compliant with the rules and regulations set forth, and learned a lot about the different tobacco product pathways, things that are allowed, things that aren't allowed. And yeah, personally, I still feel like there's a lot of work that needs to be done, but I was happy for the opportunity to work there.
Yeah, that sounds like a great experience. And would you just explain a little bit more about like a tobacco something pathway you said? What does that mean?
The tobacco product um, pathways. So there's about three There's substantially equivalent. There's substantially, I'm sorry, there's exempt from, there's an exempt request from substantially equivalent, and then there's PMTA. I can't remember the
We
the
just need
name right now.
a general knowledge.
But
Yeah.
yeah, but those are the main three application pathways, and they vary different ways. One is very very strict. One is a little bit looser. And it come to find out, a lot of manufacturers actually follow this substantially equivalent pathway because it's a little bit of a seamless route to get a product into the market. It's still a lot of loops that you have to go through, but yeah, just learning about these different pathways helped me gain a better understanding of improvements that could be introduced into healthcare. And so again, going back into health policy, that like being able to identify flaws in certain systems, I think is what like an upper hand that I have with my knowledge and education.
Okay, that makes sense. And it's just kind of cool. Just granted, it's like not tobacco is not the product that we want to see, but granted that to know that there are these different pathways that the FDA has for these types of products to get out to market, and they have different stringencies depending on which pathway you do choose. Quite interesting. And
Mhm.
then more recently, you moved into an epidemiologist role for the DC office of the chief medical examiner. So how do you come across this role and what do you do in it?
I came across this. I'm always trying to look for opportunities that are going to push me to the next step. Um, I had always been sort of interested in working as an epidemiologist, especially after my opportunity in PHAP in Arizona. I was working with an epidemiology team there, and I kind of wanted to. That was my first hand experience in epi. Yeah, once I found out there was an opening in my area for an epidemiologist, I applied, and although I didn't feel like I was an ideal candidate, um, and that's kind of like a thing that I like to try to share with a lot of individuals who are not necessarily in public health, but just in general. Always apply, always figure out how you can tie your experiences to relate to another experience. And so I apply. I highlighted the experiences that I had in Arizona because I feel like doing surveillance, looking at those cases, really benefited me and helped me, um, or really related to this role, um, providing surveillance and conducting reports and stuff like that. And so now in this role, I'm responsible for managing our data fusion center, providing reports on opioid overdoses. We have several different fatality reviews, and I support those committees with collecting their data. Um, and basically, we look at all the deaths that occur within the district, whether they be um, an accident, suicide, a sudden death, and like I said, intoxication, and we provide that to the state and our other customers, and try to provide resources to um, improve the health in the city, in the district.
That's awesome, and I'm glad that you highlighted the point that even though like you thought you weren't the ideal candidate for it, you were able to get it, and to that point, apply for people. And yeah, I agree with that because you never know, and a no it just keeps you in the same position, but you never know when that no would be a yes. Um, and and
Right,
and
exactly.
and then tying back also to like the PHAP situation, it's like even though you didn't finish the PHAP program technically, you didn't finish it, you were still able to gain skills and appreciation for something that was able to translate into you being the ideal candidate in the eyes of them in this position, which is cool as well. And and then before I move you on to the final section of the show, I wanted to ask, where would you like to see yourself in the future?
Um, I don't know. I feel like every day is is a new day, and I'm always learning something else. So I still may, build that holistic healthcare center that I mentioned earlier, or might become a director of a healthcare clinic. I'm not sure, but I just feel like public health is always evolving. Public health needs are always evolving, um, and that's kind of like why my resume has so many different experiences because the needs of our community is always changing. So um, yeah, I'm not quite sure where I see myself in the future, but I definitely still see myself helping our community.
Awesome, awesome. I'll look out to see what that is and how that all turns out for you. And we'll be sure to link you in the show notes so people can follow you or connect with you on LinkedIn. So moving on to the Furious Five, the last section of the show. Number one, what advice would you give to a student trying to pursue a career in public health?
Um, I would say uh, know that you want to pursue public health. I know, especially right now after this, where we're still in this pandemic, but I feel like we're starting to see an influx of those who are pursuing this field just because it's trending, and that's not never the right way to move forward in a career path. So I would definitely say make sure that this is something that your heart is in. Um, but always, like you mentioned earlier, never say no to any opportunities because you never know where that opportunity is going to take you.
Awesome, very great advice. Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
Kind of already already said what I was trying to say earlier, but yeah, never say no to any opportunity. Always look for opportunities to learn and grow in your role. If you feel like sometimes if you're just sitting there doing nothing, see if there's some training that you take. See if there's some training that you can take. Um, Always try to, again, like I said, expand your knowledge and find a mentor. I had a mentor while I was in PHAP that helped me um, gain a certification that I didn't think I needed, but it helped me gain some knowledge about how public health is performed in the government sector. So um, seek a mentor, especially. I think is the biggest thing you can take away, or the biggest advice I can give.
Great. Yeah, I think that's well supported advice overall. Number three, what's something you're working on improving in your life right now?
Right now, I'm like again, I'm trying to get back into a routine. So getting up early, reading, trying to get back in my physical fitness journey, but also just mental clarity. Like mental health is really important. As Black men of public health, we have to stay sharp and but stay cautious at the same time. So yeah, just working on those really those two main things: my physical fitness and my mental health.
And well, I hope that you're able to get more into that schedule and able to get more into those things. There is a book club that the Public Health Millennial is hosting or having. If you join a Discord group at the phmillennial.com/join, you could find out more information in there. We'll be choosing the book soon, or by the time this episode comes out, the book will probably be chosen. But please feel free to join and come read in community with us.
All right, awesome.
Yeah. Number four, professionally, do you recommend anything? A book, podcast, YouTube, show, anything?
I recommend the Public Health Millennial podcast. It's the best podcast out right now for people of color, minorities trying to find their way in public health. Omari has interviewed a lot of great people, and you can. I feel like I'm always learning something listening to one of his podcasts. So I definitely would recommend.
I appreciate that shout out. Appreciate it a lot. And then last but not least, where can people connect with you, Myles?
You can connect with me on LinkedIn. Myles Davenport. Myles is with a Y, Myles. That's the best way to reach me right now. I'm looking to build out my social portfolio, but feel free to reach me on there.
Awesome. And I'll be sure to link that in the show notes and people can probably just look you up by your name and find you. But thank you so much for coming on and chatting, sharing more about your story.
No problem. Thank you again. I appreciate this time, and it was an honor to finally speak with you after all this time. So thank you for having me on.
Yeah, absolutely. And definitely won't be the last time we chat, that's for sure.
Absolutely, yeah.
So housekeeping items, everyone. Thank you all so much for listening or watching to this. Greatly appreciate that. Subscribe so you don't miss another great episode like this. Leave a like if you have not as yet. Leave a 5-star review and share it with a friend. I greatly appreciate it. And be sure to join the Discord group. That's thepHmillennial.com/join. Peace, everyone.